Welcome back to Body Beautiful. We are talking right now with Dr. Elizabeth Lee about plastic surgery alternatives for the summer. First, let me remind you that we'll be taking your calls with any questions you might have for the doctor. The phone number here is 800-440-4884. We'll also be posting the number for the doctor's office before and at the end of the segment. And remember, any advice we give you today, you'll want to consult your own physician as well. You know, we're looking at Dr. Lee, and you look different. And one of our assistants said, "So have you had anything done?
Yeah,
because you look different."
She said, "You look great. What did you do?" I said, "It's new hair color."
So you can just get a new hairstyle and a color, and that can change things altogether too.
And the good thing is I know the color is different, and my good friends have immediately focused on the color. But as the patients have been coming in, they've been saying, "You look great. What'd you do? What's with your skin?" And I say, "It's my hair." And so it's fun, and that's what I get to do all the time for people, because if they come in and have a little something done, nobody knows what is done. They just know that they look like healthy.
Right.
They like it. You look good.
So let's talk about that. Healthy skin, I mean, is one of the most important things we know. It's the largest organ in the body, so it does reflect what's going on inside.
Right.
But it's the first thing, you know, people look at. And how do you get that radiant glow?
So in my office, you know, I now have two ways of doing this. So I have this Cyton laser that I've been working with now for several months, and as with everything I do, I start out slowly and carefully, and I have been so impressed with the freshening that we get for photofacial, as well as for doing some minor resurfacing procedures that might have, you know, a certain amount of downtime, anywhere from 1 day to 10 days, depending on how aggressive we are. But we can tailor that to what the patient needs.
So let me understand, because there's so many lasers out there. There's the photofacials, which you're really targeting some of the discoloration.
Exactly, pigment and red.
Too much sun.
Exactly, that kind of those large freckles, the too much red. And that's done with broadband light. And then there is actual laser resurfacing. So the Cyton is a tunable erbium laser, which the tunable part enables me to set how deep I'm actually going to go. And it's pretty sophisticated technology, but it is completely modifiable to what the patient needs. So it's not like having a hammer and the whole world's a nail.
So it's subtle.
Right.
But when you're going deeper, can you actually see results in the skin that not only, you know, superficial color changes?
We can tighten skin and treat wrinkles around the mouth, and that's not subtle. I mean, you know, there are definitely changes, and there's a healing period, but we can be quite aggressive with the skin. And you know, I want to make sure that we're choosing the patients properly, because people can get into problems when it's not being done carefully. But we can get very aggressive, or do the kind of thing where you just look better, nobody knows why, and there's no downtime.
Okay, you mentioned about the photofacials.
Yes.
So, you know, if somebody's had too much sun,
photofacial is a beautiful, quick way to get
rid of those
done.
Brown spots.
It
sometimes
does.
If you're taking hormones or you're pregnant,
melasma, absolutely.
And how about rosacea, broken capillaries?
We can treat that with the broadband light, with the photofacial too. Small capillaries we can treat with the laser.
Okay, and the downtime with that?
Well, the downtime, the downtime may be that you could get some bruising when we treat the capillaries, although that's very unusual. And when we do the photofacial, the brown spots may get a little bit browner for a couple of days before they disappear.
Does this also reverse some damage that?
Well, that's the thing. You know, the photofacial doesn't really reverse damage. It doesn't make your skin healthier. Doing careful resurfacing can put the skin in better condition, but again, that's where I go back to my good old fallback, the Obagi skincare, New Derm skincare system.
Okay, we hear a lot about it.
We do.
What's so special about it?
It is basic active ingredients, but Obagi has a delivery system so that we're getting the medication to the deeper layer of the skin to actually make changes. Because remember, your skin's function as an organ is to keep things out. So when you put cream on your skin, it can have fabulous ingredients in it, but if it's not getting through the skin, then it's not. It can only be so active.
Well, sometimes, I mean, you put a cream on and it kind of plumps it up for about a minute.
Right.
How long does this stay with you? I mean, if you stop using the product, does your face start to crinkle again?
You know, the aging process will go on, and certainly when you come into my office, one of the things that I try to do is help you minimize the things that are damaging your skin, most predominantly sun. And so once you're finished doing the treatment, you can go off the product, and as long as you're protecting yourself from the sun, you'll maintain part of what you've gotten. But obviously, we can't reverse aging.
Right. So you get that radiant glow, and not because you've been out in the sun, cooking your skin.
Right.
Subjecting yourself to, you know, the possibility of cancer.
And UV radiation. Right.
We need to take a quick break. We'll take some of the calls when we come back. But for more information about Dr. Lee, you can call our office at 510-704-2170 or check her out on her website at artfulsurgery.com. When we come back, we've got some more ideas from Dr. Lee about how to spruce up for the summer, alternatives to plastic surgery. Plus, we'll take your calls.